Assalamu alaikum. This is Dr. Hasna with Hasna That Me. Thank you so much all for tuning in once again in the subscriber week, where I will today be talking about one of the most requested topics after the lower limb muscles is the upper limb muscles. And today we're also going to be discussing some of the forearm muscles. Okay, so let's get started. Basically, what we're going to be doing here is that talking about what is that little secret that somehow we can figure out what is supplying what. And when I see in an MCQ, instantly I know what to write when there's a muscle in front of me and what is its nerve supply. All right, so let's first talk about the arm. I just want to give you a little idea of what the upper limb is divided into. We have this area from the shoulder joint to the elbow joint. This is known as the arm. I know I'm talking about basic stuff, but guess what? Students actually don't know such a basic concept. So let me just build that for you, okay? So now we know that the arm has an anterior compartment and a posterior compartment and the muscles within it. Similarly, in forearm, we have anterior and posterior, and then we have this hand. I want you to remember the nerve supply in this way. All the muscles of the anterior compartment of the arm are going to be supplied by musculocutaneous nerve. All the muscles of the anterior compartment of the forearm, what's going to be happening in the anterior compartment is a huge competition is going to be happening. Like there's going to be a war happening between two nerves, our faves, the ulnar nerve versus the median nerve. A huge fight is about to take place over here, but we'll get to the juicy details later. For now, let's move to the hand. In the hand, I want you guys to remember once again, ulnar nerve, median nerve will be facing another face off, but in this case, I want you to remember this mnemonic goes like TL12. Okay, now that we know a little bit of idea of the anterior compartment of the arm, I just want you to remember that the posterior compartment of the arm, thank God that is a more simpler compartment, and all you have to remember for that is that the entire posterior compartment will be supplied by radial nerve. From the arm to the forearm are all going to be supplied by the radial nerve. So guys, this is a basic shortcut of it. So what was I talking about when I said that there's going to be a huge war between ulnar nerve versus median nerve? I just want you to remember for the forearm that all you have to remember is that the ulnar nerve is going to be supplying the following muscles. This is, what do you think it could be? The flexor carpi ulnaris, obviously, or what else can it be? Ulnaris, obviously, because it's a medial muscle. So flexor carpi ulnaris, plus just remember this, guys, it is going to be the medial half of profundus, flexor digitorum profundus. This is for the anterior compartment of the arm. And apart from these muscles, any muscle that they ask you in the anterior compartment of the forearm, you're going to say it's median nerve, either median nerve, but if it's a deep muscle, you'll just say it's anterior interosseous nerve, which is basically a deep branch of the median nerve. Okay, but then what about the hand? Mostly because the ulnar nerve in the forearm got very few muscles and median nerve got loads of them. So ulnar nerve is going to be like, I need to take charge when I get to the hand. Median nerve, please let me get some attention. Please, median nerve. And this median nerve is like having its evil laughter. Ha 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 ha. So ulnar nerve is like, please, in the hand, I'm not going to face this inferiority live. I'm going to be supplying most. So majority of the hand muscles are going to be supplied by the ulnar nerve in the hand. And what's going to be supplied by the medial nerve? Just the TL12. Apart from these muscles, all are supplied by ulnar nerve. So what are these exceptions? These are the thenar muscle. Thenar eminence has three muscles: abductor, flexor, pollicis, and the opponents. All right, pollicis. Lumbrical 1 and 2 is going to be supplied by median nerve. Otherwise, all the hand muscles, whenever you see a hand muscle that is not a part of the TL12 right here, you're going to say it's going to be supplied by ulnar nerve. Now I just want to discuss with you a bit about the forearm muscles. What do we do about the forearm muscles? They're quite difficult. I've had a request on this topic. What we're going to do is we're going to divide the forearm muscles into the back muscles and the front muscles. What I've noticed is that what you're facing most difficulty with in these muscles of the front and back is the origin insertion, because that is actually a lot, guys. I just want to give you guys a little bit of a good news is that you don't have to completely go over and beyond when it comes to learning origin insertion. You can totally take shortcuts. So what I want you to remember, in the front of forearm is divided into superficial and deep compartments. In the superficial compartment, all the muscles that you see are going to originate from the medial epicondyle of the humerus. This is known as the common flexor origin. Whereas in the back of the arm, I just want you to remember the lateral epicondyle, which is going to be the common extensor origin. All right, so this is a more easier way of learning. Try to learn stuff in a more grouping form. All right, so in the case of deep muscles, I just want you to remember there are three: the flexor digitorum profundus, the flexor pollicis longus, and the pronator quadratus. The only thing you have to remember for this is, since pollicis, what do you mean by pollicis? It means it lies on the lateral side. So what is the lateral bone? It's the radius. So this comes from the radius, this comes from the ulna, and pronator quadratus comes from the two radius and ulna. How difficult was that? I think that was the easiest. So these are a couple of shortcuts that I wanted to reveal to you. Apart from that, if we talk about the nerve supply, you know this. In the front of the arm, we have what did we already discuss is the ulnar for these two, and the median nerve for the rest of all the muscles: flexor pollicis longus, lateral half of the profundus, etc. And in the hand, we've already talked about this situation. And now that we look at it, it isn't that hard. All we have to do is, now the names of the muscle will guide us to the action. We know the nerve supply, we know the origins, and insertions are also not that difficult to learn. If you know this, I'm sure you're feeling confident enough to go through the rest of the stuff. Don't ever go into the depth or like detailed paragraphs. Always learn it in a shortcut way, and this is the shortcut way. I give you all these cool mnemonics and tricks. So guys, do not forget to click on that subscribe button. Happy subscriber week to all of you. Really hope I made this concept easy for you, and I'll see you in the next video. Thank you so much for watching.